Standard 3.2 Psychosocial Distress Screening is a new 2012 standard and must be phased in for 2015. All cancer programs will need to demonstrate that they screen diagnosed cancer patients and identify the issues that can negatively impact their treatment and outcome. Issues related to depression, financial matters, insurance, social and family relationships, spirituality, and even employment can cause psychosocial distress for patients already dealing with a cancer diagnosis. These patients should be provided with resources or referral to a behavioral health professional, or both. This standard is important because in order to provide the high-quality cancer care associated with a COC-accredited program, psychosocial distress must be identified and treated at every step of the cancer continuum. These patients should be monitored, evaluated, and followed so they can fully participate in their treatment by actively managing their illness and any side effects. Programs can meet the standard by developing a process to screen cancer patients at prescribed intervals soon after diagnosis. The entire oncology team of medical and/or surgical oncologists, radiation oncology professionals, nurses, social workers, and/or psychologists should be involved in identifying the presence of stressors and then take action through the provision of resources and proper referrals to on- or off-site providers. The process must be reviewed and evaluated by Cancer Committee at least annually in order to implement evidence-based changes and any needed improvements. Cancer programs receive a compliance rating when they develop and implement a psychosocial distress screening process, which provides for referral to a behavioral health professional when specified by the screening tool. The psychosocial representative to Cancer Committee must oversee this activity and report to Cancer Committee annually. Documentation consists of completing the SAR and providing written documentation of standard compliance in the Cancer Committee minutes. Policies, procedures, descriptions of staff education programs, and other supporting documentation may be included. The on-site visit with the surveyor will include a discussion about the method, tools, and referral to resources. A multidisciplinary approach is one of the best ways to comply with this standard. By involving those disciplines that treat and interact with cancer patients, the opportunity to identify the signs and symptoms of psychosocial distress is increased. Referring to the best practices repository can yield approaches that have been successful for other programs. The process should be designed for use by any cancer care provider. Communication between providers should be accomplished in a structured and clearly outlined process, allowing for prompt evaluations and referrals. Patients should feel that their needs are being recognized, validated, and met. Thank you for viewing this video on the COC standards, and remember to view the remaining videos in this series to further increase your knowledge on the standards. For additional resources, be sure to visit the COC website at www.facs.org/cancer to access the COC Educational Portal, Best Practices Repository, and Cancer Forum.